rolling. Okay, part 2 of this video. I'm doing it in 2 segments because it's going to be way easier to upload. Hope that's okay. We're going to start by assessing our patient, asking them about vomiting, about diarrhea, nausea, what their bowel movements are looking like. I'd want to listen to bowel sounds. They're sounding a lot better, so that's good. I'm glad to hear it. Pain level, looking at the distension of the stomach. So things are looking a lot better. And 2 days later, doctors ordered that we take this out. So I would get some adhesive remover, and we're gonna go ahead and rub this adhesive to take this tape off. Perfect. We're gonna be unstrapping it from the gown. Perfect. And then I'm gonna unclamp this. And for video's purposes, I'm just gonna bring this back and we're gonna go back to our nose. So, hope that's okay. You're free to go. Thank you. Okay, so this was at 55. Perfect. Okay, now the suction's been turned off for about 2 hours because the doctor wanted to make sure that it would work well. So this is currently clamped. They clamped it when they took him off of suctioning. So after we've done our assessment, I'm gonna go ahead and pull up 20 mils of my sterile water. This will help us flush it out so that we can make sure that we're not pulling out any stuff with the tube. So what I'm going to do now is, but before we get started, I need to check placement. So you can check placement 3 different ways, like we mentioned: X-ray, the pH strip, and the whoosh, the sound of the air. So we'll check it that way. We've checked it, perfect, everything looks great. Another thing that I forgot to mention earlier was that we want to make sure that it's not gooping up in their throat. You want to check with the tongue depressor, but I don't have one, so just that's there. Okay, so we've checked placement, everything looks good. I'm now going to use my 20 mils of water and sterile water, and we're going to unkink and flush with the water. Perfect. We're gonna kink it again, pull this out, and I'm gonna get about 20 mils of air, push it in, unkink, push it in, kink again, and let go. Okay, so, all right, Maria, we are about to pull this out. I just need you to take a good deep breath for me, and hold your breath for me, okay? So, on the count of 3, ready? 1, 2, 3, hold your breath, pull it out, place it on the tubing. They might be gagging at this point, so we have this space in here if necessary, and we're just gonna go ahead and wrap it up. We can go ahead and toss it. I'm assessing her to make sure that she's feeling okay, she's breathing fine. You're gonna wanna assess every 2 hours to make sure that they're not nauseated or vomiting or things like that. You're gonna wanna check the distension of their stomach. But Maria, you're doing really well. Do you have any questions for me? Nope. Okay, well, I'm proud of you. Everything looks great. If I wanted to, I can assess, listen for bowel sounds right now myself. Everything sounds good. She's doing it well. So I'm gonna go ahead and take my gloves off. I'm gonna wash my hands. I'm gonna lower the bed. We're gonna bring over some water that she can sip on. Give her call light, the remote, things like that. Maria, I'm gonna be back in about 45 minutes to check on you. But if you need anything, please feel free to press your call light and we'll be in, okay? All right, well, have a good day. And then I'll open up.